Hello everyone, I'm Anastasia signing in from Nora's. In our previous sessions, as we have started discussing about the process of bowel elimination, in this session we will be discussing about the various factors that can affect the bowel elimination of a person. Here, as we know that many factors influence the normal bowel elimination, so here knowledge of these factors is very important in order to anticipate the measures which would be required for one to have a normal bowel elimination. So there are various factors that can affect the normal bowel elimination. The first one is the age. Here, there is a marked difference between the stool of an infant to that of an older adult. As we know that in children's as well as in the infants, their neuromuscular system will not be developed. Therefore, these children will not be able to have a control on their bowel pattern. So here, these developmental changes affecting the normal elimination occurs throughout the life. As we also know that an infant will be having a small stomach capacity and that there will be less secretion of the digestive enzyme. So what happens is, as a person intakes any food, there would be a rapid movement in the intestinal tract, and this would lead to rapid peristalsis, and because of this the infant will not be able to control their elimination, because we have discussed that the neuromuscular system will not be fully developed. So because of this, because of rapid peristalsis and because of less production of digestive enzyme and a small stomach capacity, there will be changes in the elimination pattern of an infant. Here, systematic changes such as changes in the cardiovascular as well as the neurological system can also affect the normal bowel elimination, because it is through this that the role of absorption as well as digestion of nutrition takes place. So here, rather than any changes in the GI system, if there is changes in the cardiovascular or even the neurological system, then this can also affect the bowel pattern. And not only that, but as we also know, in older adults, the muscle tone in the perineal floor as well as the anal sphincter will be loose. Although the integrity of these sphincters remain intact, however, an older adult will be finding it very difficult to control their evacuation and will also be at a higher risk of incontinence. So here, as we have discussed that in an infant, because of the non-developed neuromuscular system, he or she might not be able to control their elimination. And as we have also seen that in older adult, because the muscle tone in the perineal floor as well as the anal sphincter will be loose, so this can also affect the normal bowel elimination of a person. So here, this is the reason why age is one of the factor. The second one is the diet. Regular daily food intake helps to maintain a regular pattern of peristalsis in the colon. Fiber, the non-digestible residue in the diet, provides the bulk of fecal matter. So here, a person who is consuming a fiber-rich diet, which include of certain fruits, vegetables, as well as whole grains, help to remove the fats and the waste products from the body of an individual more efficiently, because here the bowel wall will stretch, creating peristalsis, and because of this it would also initiate the defecation reflex. So here ingestion of a high fiber diet improves the likelihood of developing a normal elimination pattern, and also in certain cases the intake of spicy food also increases the peristalsis. However, this can also lead to indigestion or even to a watery stool, and because of food intolerance it can also affect the normal bowel elimination pattern, because here this food intolerance sometimes may not be because of the food allergy, but rather a particular food that causes the body distress a few hours after it has been consumed. So because of this, it can lead to diarrhea, cramps, or even flatulence. So here, as we have seen, depending on the diet which we consume, it can also affect the normal bowel elimination, because here, if we are following a high fiber diet, then it can improve the normal bowel elimination, whereas sometimes when we are following any other diet, when we are having spicy food, or even when we are having allergy or we are intolerant to certain foods, intake of that can affect the normal bowel elimination. The third is the fluid intake. Here, adequate fluid intake or disturbances such as vomiting resulting in fluid loss can also affect the character of the stool, because here, as we know, that fluid helps in liquefying the intestinal content, which would lead to an easy passage of it through the colon. So here, if a person is not having adequate amount of fluid, or if he or she is having any disturbances that can lead in fluid loss, such as vomiting or diarrhea, then this would lead to dehydration and loss of electrolyte, which would further lead to hardening of the stool content. Unless contraindicated, it is advisable that each and every individual must consume 1100 milliliter to 1400 milliliter of water per day. An increase in the fluid intake with the use of fruit juice can also soften the stool and increase peristalsis. Whereas if there is a poor fluid intake, then it can increase the risk of constipation, because here there will be a greater reabsorption of fluid in the colon itself, which would ultimately result to a dry and a hard stool. So here it is very important that we must take adequate amount of fluid in order to increase peristalsis, in order to soften the stool, and because of this it would lead to a normal bowel elimination. The fourth is the physical activity. Here, physical activity promotes peristalsis, whereas immobilization depresses it. So here it is our responsibility that we must make sure the patient resume their normal activities as soon as he or she is developing or begins to resolve from any illness or as soon as possible after he or she has just undergone any surgery in order to increase the peristalsis, which would lead to a normal bowel elimination. As we also know that maintaining the tone of the skeletal muscles used during defecation is also very important. So sometimes you may find that these muscle tones may be loose or may be weak because of certain conditions such as the spinal cord injury, long-term illness or neurological diseases or disorders that impairs the nerve transmission. So as a result of these, there may be changes in the abdominal or the pelvic floor muscles, which would at the end lead to constipation. So here it is very important that we must advise the patient to resume back to their normal activities, to perform certain exercises as soon as she or he have just recovered or is in the process of recovering from illness, or as soon as possible after any surgery had been performed in order to increase the peristalsis, which would lead to a normal bowel elimination. The fifth one is the psychological factor. Here, emotional stress can affect the body of a person in many ways, because as we can see that a person who is anxious or who is suffering from any anxiety might be having an increased intestinal motility, whereas a person who is under depression will be having a decreased intestinal motility, which can also lead to constipation. So here, if a person becomes depressed, then the autonomic nervous system slows the impulses. There will be decrease in the peristalsis, which would result in constipation. So this is the reason why psychological factor is one of the reasons that can also affect the normal bowel elimination. The sixth one is the personal habits. Here, the personal elimination habits can also influence the bowel elimination pattern. Most people benefit from being able to use their own toilet facility in the most effective as well as the convenient time for them. However, if a person is under so much stress, if a person is so into his work that he or she neglects the urge of defecating or even urinating, then this would alter their normal bowel elimination, and this can again lead one to suffer from constipation. Therefore, individuals need to recognize the best time for elimination. They must make time for themselves. They must make sure that they follow their routine in the timings where they will be free and which would be convenient for them, so that their bowel elimination pattern will not be altered. So this is related to the personal habit. However, when we talk about the patients, here even if that patient has been following a normal bowel elimination pattern, but because of his or her disease condition or because of hospitalization, their bowel pattern may also be altered because of embarrassment, because of discomfort, or some patients may not like the sharing of the toilet, but when they are in the hospital, they need to share it. So because of that, they may not be willing to use the toilet, and this can lead to again alteration in the bowel elimination. The next one is the position during defecation. Here the position which one is in during the process of defecating also plays a major role, as we know that squatting is the normal position because it is in this position that it would help to exert pressure on the intra-abdominal areas, as well as it would help to contract the thigh muscles. So if a person is not able to take this position because of his or her disease condition, let's say for example a person who is bedridden, they may not be able to squat while they are defecating. So what we normally do is we provide a bedpan. However, since they will be in a supine position, then they may find it very difficult to defecate. So here, if their condition permits, then you can raise their head end and you can assist them to a normal sitting position on a bedpan so that it would enhance their ability to defecate. The next factor is the pain. Here, normally the act of defecation is painless, but if a person has just undergone any surgery in their rectal area, or if he or she is suffering from certain conditions such as hemorrhoid, then this can also lead one to suffer from pain during this act of defecation, which would create a feeling where they will not want to defecate, and because of this they will control their urge and it would then lead to constipation. The next one is the pregnancy. So here, as pregnancy advances, the size of the fetus will also be increased, and this size of the fetus would exert a pressure on the rectum. Because of this temporary obstruction which is created by the fetus, it would impair the passage of the stool. The next is the medications. Here some medications have a certain expected actions on the bowel. For example, if a person is having diarrhea, then certain medications can be prescribed in order to control it, whereas even if a person is having constipation, certain medications can be provided. So here certain medications which we are providing to the patient has an expected action on the bowel. In addition, medication prescribed for acute or chronic condition can also lead to a secondary effect on the patient bowel elimination. For example, laxatives and cathartics can be given in order to soften the stool and also to increase the peristalsis. However, laxative overdose or overuse can also cause severe diarrhea, which can lead to dehydration as well as loss in the fluid and the electrolyte, which ultimately can result in constipation. So here medications also plays a major role here, because through this it can also affect the normal bowel elimination pattern. The next is the diagnostic test. So here, any diagnostic examinations involving the gastrointestinal tract requires the preparation of the bowel, whereby the bowel must be emptied. So if a person has to undergo any diagnostic study such as the endoscopy or the colonoscopy, they will be advised not to take any fluid or not to consume any food for a period of time. So here, because of not intake of food for a period of time for the performance of the diagnostic test, once a person, after he or she has undergone the test and once he or she starts eating or take fluid, then this can again lead to changes in the bowel pattern, where one may find that he or she might be having loose stools or even increased gas. And the last one is the pathological condition. Here, the spinal cord or even the head injury can decrease the sensory stimulation for defecation, and because of this impaired mobility, it will limit the patient's ability to respond even to the urge of defecation. So this is the reason pathological conditions can also affect the bowel elimination of a person. So now here we have come to the end of this topic, whereby in today's session we have discussed about the various factors that can affect the bowel elimination of a person, and these include the age, the lifestyle, the psychological factors, the pathological conditions, the medications, the pregnancy, the personal habits, as well as the position during defecation. So I hope you have got a clear understanding of this topic. I'll be meeting you in my next session, where we will be discussing about the alterations in bowel elimination. So until then, have a good day. Thank you.